So this video is the setup, preparation, and process of placing an ulnar gutter splint along with a sugar tong splint. First off, you will need ortho glass. It can be 3-inch or 4-inch. In this case, we are using 3-inch. You will also need a stockinette. Usually, if it's for the leg or the lower extremity, you'll use 4-inch. Or a 3-inch depending on the size of your patient. We are using 3-inch today. A pair of scissors is always helpful. And then we have cast padding. It can be 1-inch, 2-inch for the ulnar gutter, or 3-inch depending on the patient's habitus. And then you'll want ace bandages, and those could be 2-inch, 1-inch, 4-inch, 6-inch. Today we're just using the 6 and the 2-inch. Along with a 3-inch as well. And then it's always nice to have a pair of gloves just to be able to keep from sticking to the ortho glass. That always makes it nice. And then we've got a towel here for drying off the ortho glass. And then of course we have a water source. Alright, we're going to go ahead and demonstrate the ulnar gutter splint. This would be utilized in emergency room and or in orthopedics for any type of distal boxer's fracture, maybe any of the finger or the phalange fractures, along with a small fracture along the wrist. The goal is to keep from having the hand move or rotate. So the ulnar gutter splint is what we will be doing. Again, with our patient, we want to make sure that we take the stockinette. That's our first decision item that we will need. We're going to measure from the actual fingers all the way to the elbow. All right. Again, with stockinette, if you have too much, that's okay. You can always cut it off. But if you can get as close to what you need as possible, then it's always better. All right. In this case, we will also then have her rotate her hand so that I can lay it in there, make sure it measures correctly, and then I'm going to find where that thumb is, and I'm going to place that little triangle. And that will basically give the thumb a chance to escape. All right. Go ahead and place the stockinette on. And let that thumb pop out. All right. Cut that a little bit too much, that's okay. The next step is going to be to utilize our cast padding. Please note that cast padding as well as ace bandages go on better if they are rolled on. So you keep the piece that's being rolled out close to your skin. If we roll it out this other way, we may get a little too tight and could cause some tightness to occur around the wrist, the hand, etc. Right now, what we're going to do is we're going to go ahead and start wrapping the hand. We do, again, start distal, and then we go proximal. The great thing about the cast pad is that you can tear it and you can maneuver it however you may need to maneuver it. And if it's just too much or not enough, you can always just rip it off. The goal of the cast pad is to basically protect the hand and wrist from the casting or the splinting material. It is not to basically help or keep the fracture in line. So again, that's kind of just bothering me a little bit. And we will want to wrap pretty far up, but not all the way to the elbow, just about a couple centimeters or so below the elbow. Now with an ulnar gutter splint, we're really focusing on these last two fingers here. A couple options that you could utilize. You could leave these fingers free. And we can do that a couple ways. We can cut and leave the fingers and then remove this section here. The other option would be to use a 1-inch stockinette and just place it over the last 2 fingers. Today we're going to go ahead and just snip down because we don't want the index and the middle finger to be affected too much by the splint, but we want it to be protected. All right, so just kind of moving that down right now for that. All right, and that gives her mobility there. All right, the next step is to come to the orthoglass, and we should measure about how much we have. I've measured her earlier, so I know that a little bit less than 1 foot is what I will need for her. And it was easy for me just to go ahead and cut the orthoglass. 2 things I want you to understand about orthoglass. Orthoglass comes in a nice big roll, and it's sealed and it's very malleable. Once we cut it though, air can get in, so whatever is closest to the end, unfortunately, will harden. And you can't see this, but on this edge piece here, what we've done is it is hardened. So it is completely hard and not malleable like the rest of it. So real important, especially when you're done cutting, please make sure that you roll the edge in. Push that orthoglass in as far as you can and use the clip, like a chip clip, to cover over the area so that it's sealed off. And that will save us from having to buy more and keep your preceptors from being angry at you when an entire roll has been ruined. So we'll go ahead. And I'm going to put some gloves on now, only because this stuff can be a little sticky. And just so you know, one other pearl with the orthoglass, if you want to zoom in here, it's covered with a felt, which is great. If I loosen the felt, I can take the inside out. So if you have a smaller individual, smaller than Juliana here, you could take the felt off in order to just utilize what's inside, and that may give you a little bit more of a control than with the felt on. So of course, we need to cut to that length that we want because we cannot use this section here. And this edge can always be really, really sharp, so do me a favor and be nice to your patients and pull that felt up and over it and seal it so that there's no sharp edges. At this point in time, I can leave it in this form and place it on the patient, or I can go ahead and get it wet. The hotter the water you use, the quicker it will set up. So I'm just going to use kind of a nice fluid, kind of a mid-tempered warm water, and just run it over it. This felt has a tendency to hold onto a lot of water. Water is one of our big concerns. If it sits on the skin too long, it can cause maceration. So you'll want to squeeze it out the best you can. In this case, because I don't have a towel, I'm actually going to take the insert out and just get it wet, and then I save myself from having felt be too wet and cause some maceration of the skin. So as far as the water goes, I am just running it through. Nothing too crazy. I can wring it as well if I need to, but I feel like it's starting to harden already. So I do want to make sure that I have enough time to get the splint on the patient. How are you doing, Juliana?
Good.
Good. So, ulnar gutter. Ulnar side, right? Gutter is basically just making a gutter so that that finger will fit right in that area there, okay? I did make this a little too long, so I'm actually going to cut it one more time. And that's always the case. Sometimes you just don't know after you've messed with it how long it might be. All right, so it's starting to want to harden up here. So basically I put the splint here. I can use my edge to fold over if I want to. Just gives it a nice protection again, because I do want her to be able to move her fingers. And then I can also fold this edge down here. So we'll fold that over it. And it just gives it a nice little clean look. Can you hold this for me, Juliana? Mm-hmm. Thanks. Again, let your patient know that it will warm up, and it possibly could cause a person to be afraid, but it will not burn them, all right? It's just going to warm up as that chemical reaction goes. I usually start at the wrist itself, just because it gives me a nice area to lay the ACE bandage down. Please note, I'm rolling the ACE bandage. Okay, I'm rolling the ACE bandage. Oh, we're just gonna go this way. Now, if I had a separate stockinette here, I would possibly go through with a 1 inch, but today I don't, so I'm not gonna do that. And you can already feel that it's starting to harden, can't you? Mm-hmm. Good. You want to pull about 10 to 15% so that it's tight and will give her the compression that she needs, but will not cut off circulation. This is an old school ACE bandage. I haven't seen one of these in a while. Okay, and now I need to make sure that I am putting it in neutral position as well. So I'm just going to hold it as if she's holding a Coke can. Make sure you have your fingers in there. Couple areas that can always be troublesome will be the area around the thumb, along with the area around the pinky. So if you can, just kind of pad that a little bit so that it's not a cause for irritation and or a lesion or any type of infection. All right. Up here at the same time, sometimes you may have to cut the ACE bandage just to loosen the area right along that thumb. But you always want to make sure that it's in good position. And always when you're done, check the capillary refill and make sure that it's doing well. Also close your eyes. Can you feel this?
Yes.
Does it feel the same as this?
Yes.
Okay. So do your neurovascular check as well. And at this point in time, I'm going to tell the patient she will follow up with orthopedic in 5 to 7 days. Or you'll come back and see me depending on what kind of clinic I'm in. And as you can see, it's starting to harden up. And that's an ulnar gutter splint. Thank you.